Good afternoon, and thank you guys so much for joining us today. We're honored to be a part of your Thursday afternoon. We hope all of you are gearing up for an enjoyable and safe holiday season. Today, we're extremely excited. We're bringing to you the NCS4 Technology Webinar Series. In this series, we're able to discuss various technologies. We bring in practitioners who can discuss how we're deploying technologies, how we're deploying process, and certainly share and educate the group on their experiences and share some of the best practices and tips and tricks they've learned along the way. Today, we partnered with Axis Communications to deliver you this webinar. So we're, again, happy to have you all here. A couple of things that you need to be aware of before we get started. First off, we encourage you guys to ask questions as much as possible from start to finish here. We want it to be as interactive as possible. So if you're on a laptop or a desktop, on the right-hand side of your screen, you'll see a little questions function. Please make sure that you post those questions. And again, we'll have preset breaks to take throughout the presentation where we'll stop, look at those questions, ask them to the panelists, and hopefully get you some answers. So please feel free to take advantage of that question opportunity. If you're on a smartphone, at the bottom of your screen, you're going to see a question mark. You can click that question mark and post your question there. Before we get started, I'm Daniel Ward. I'll be the moderator for this session. I'm the Director of Training and Exercise at NCS4. Again, thank you all for being here. The rest of our panel today, we're going to be discussing leveraging technologies to enforce policy and procedure. And our panelists consist of Adam Stockwell, who's the VP of Security for the Milwaukee Bucks. If you could give us a quick wave, Adam. Troy Brown, who's the VP of Stadium Operations for the Cleveland Browns. Troy. And then we've got James Reynolds, who's the Regional Director of Safety and Security for Eastern US and Canada for Hilton. And last but not least, Ryan Zadalokin, Senior Technologist for Axis Communications. And I did practice that last name before we got started. So again, happy to have you all here. Please make sure that you pose those questions throughout the presentation. We will stop and field those questions. And if we can't answer it during the presentation, we will certainly try to get back with you following the conclusion of the presentation. So again, thank you all for being here. I'm going to go ahead and start things off by handing the floor over to Adam.
Thanks, Daniel. Pleasure to be here. Thanks to NCS4 and Axis for having me. It's always a pleasure to join in. Clicking through the slides here. All right. Again, Adam Stockwell, VP of Security for Milwaukee Bucks. We're very fortunate. We have a brand new facility. Relatively, it's opened two and a half years ago now at Fiserv Forum here in Milwaukee. Had the opportunity to put a lot of technology, a lot of new leading edge systems inside this building, and it's really been a fun thing to be a part of. Next here. Okay. The question is, how did we respond when COVID happened? I think when this first happened, we all thought, hey, it's going to be 3-4 weeks, couple months. Let's get our plans together and be ready to go. So there was a lot of very fast and furious. I think all of us in the industry experienced this, getting plans together. What are we dealing with? And that went from March until about June, full bore. And to be quite honest with you, it got a little overwhelming there towards the end, so we took a break. But how did we initially respond? We locked down, we sanitized, we began the restart planning process. That started with a small document that built into a larger document. We're beholden to league security with the standards of the NBA as well. I think that document's now for us is about 160 pages of cleaning standards and process and procedure. A lot of that falls under our operations department to put together, Dennis Williams and his staff. So then we also started assessing new technologies that can assist us in the COVID era. We've discussed it a lot. We make a lot of jokes about it. We started getting inundated right away with emails, phone calls, look at our technology, this is how we can help you, and had to sift through a lot of that information and assess what was important, what was going to take priority, what worked and what didn't work. A lot of the stuff didn't work, and to be quite honest with you, that assessment process started to become a burden rather than a help in trying to get ready for this reopen. So we had to make some decisions there to maybe go back to the basics, which I'll get into that a little bit later as well. Let's see, going next. And then, like I said, getting back to the basics. What's our process? What's our procedure? Let's take a step back rather than coming up with complex plans, break it down to simple steps. What's our ingress plan? What's our credentialing system going to look like? it looks like we're going to have to go into a zone system, tested individuals, non-tested individuals. So I'm in an arena environment, which is similar but very different from a stadium environment, open air versus closed facility. We have 20,000 people in our building. Troy's probably got, I don't know, 80,000 people in his facility. It's two very different things to deal with. So let's get to the basics and figure out how we're going to make those decisions of keeping it simple to get back into the game. Like I said, we went to a written return to operations policy. The league mandated that we write one. It was written and rewritten and reauthored. The big part of this is we had to work very closely with our local health department. The thing that's really interesting in the industry, and everybody knows it, it became very, very clear to us. We want to get back to operations with everybody in the building. State by state and municipality by municipality, though, are beholden to their local health department rules. So in certain respects, national organizations, whether it's the NBA or the NFL or NHL, are actually beholden at the franchise level to that local health department. And the fact of the matter was the health department here, and I think a lot of other people experienced the same thing, they didn't have an answer because they've never been through this before. So they looked at us and said, well, what do you guys think? So we took that operational plan that we had written and rewritten, presented it to them, and started socializing it with them to get them comfortable with what our thought process and procedure is. And to be quite honest with you, these professional sports organizations at the league level were doing so much and requiring so much, the health department started adopting those rules and regulations and thought processes based off of organizational thought, our medical director's input into the local, reopening local facilities. So the irony in that is until 2 days prior to our first Marquette game, we were only legally allowed to have 10 people in the building. We didn't get authorization to have folks in the building until the day before the game. In Milwaukee, we are capped at 250 people in the facility, and that varies from arena to stadium across the country. There's places down south that already allow 20,000, 30,000 people into arena or into a venue. We're just not there yet. Big thing for us was developing the zones and credential system. That was once we wrote that manual and the policy, and the ops folks started handling how we're going to clean and sanitize this stadium. We needed to break our arena, which is, we have eight levels to our arena. Each square foot had to be accounted for in a zoning plan. We have a testing protocol in place. We have players that are tested daily, and that bubble of player personnel, staff, trainers, coaches that work with them are tested on a daily basis. We have to segregate them, provide separate zones of access throughout the facility, as opposed to folks that are not screened daily. So we have the folks that are screened daily, our event personnel. We have to test them twice in the 2 days prior to an event day. So your $15 an hour employee is required to come in twice before their working shift and take a COVID test, which presented another challenge because we realized we had to pay them, and there were certain labor rules with the unions that we had to work out. It got very expensive very quickly. So this is an example of two of the floor plans of our building. The one on the left is our event level, so that's court level of our facility. You can see a great part of that is made up with red zoning and then yellow zoning, and we had to figure out how to break those zones so people don't cross over and cross-contaminate. And the next level you see up there is the main concourse level, which is actually 3 levels up. Mostly yellow folks and green folks that are not tested, and how do you keep them separate, ingressing and egressing the building. So we had that brought us to our credentialing. We took our traditional credential format, and you can see at the bottom, again, the league had input in this as well. You had to put a very big visual indicator, what zone you're allowed to go into, and then you had certain endorsements, which I won't bore everybody with, what the numbers and letters mean. Locker room access, referee locker room access, zone 1, zone 2. It can get very confusing very quickly. The important thing for us was this the red coloring down here at the bottom, and that indicates what zone they're allowed to pass into. And the other part of this, we've realized after the first event, you can say zones and colors all day long. There's a strong education piece that for everybody about what these colors actually mean and what you can and cannot do. So this was a big step in the process for us. Going into the parts of the presentation here about technology, like I said it before, we were inundated from the beginning, day one. here's our product, here's our thermal scanner, here's a thermal scanner that's built into your magnetometer. It'll also, I mean, to the point, it'll wash your car, it'll do the dishes. I mean, it was amazing what people were claiming would happen. We quickly started referring to it as snake oil. So we really had to get into a strong vetting process, and the drawback to that was it started eating up a lot of time. So I say buyer beware. Whenever we go to these technology shows or what have you, keep in mind that salespeople are trying to sell you stuff. We rely on the industry. I know in my experience, the past 5 years that I've been here, talking to each other about what works and what doesn't work, what can stand the test of time and what breaks easily. There's a reason that the same magnetometers are used over and over again. The same VMS systems are utilized over and over again because they've been proven in the industry and work. Shameless plug, Axis cameras. I have 100% Axis cameras in my building. They came highly recommended and they work. They've been awesome for us, and they continue to improve as we go along here. So some of the technology that we did employ, temperature screening was a big one. Everyone wanted a temperature screening. You hear it's important, it's not important. Full transparency, one of our founding partners is Johnson Controls, and Johnson Controls took over Tyco a couple of years ago, merged, and they had a brand new camera coming out that we were able to get a hold of the prototype of, and it's this temp screening Tyco Alestra 5 megapixel thermal EST that was legitimately able to take facial temperatures at the corner of the eye as the measuring point. And so there's a facial recognition component to it, and it can do it in real time while you're walking through a corridor. You don't have to stop, wait for your temperature to be taken. What we realized in the vetting process is if there's 100 cameras out there claiming they can take your temperature, only the ones that have the black box in the background to account for ambient temperature are the ones that can actually claim to take a proper temperature. So we realized that, and that took that list very quickly down from 100 to about 4 that we would seriously consider. And then with the relationship we had with our Johnson Controls partnership, that became a smart install for us. So this is the corridor leading into our main checkpoint area with the 24-hour entrance in the building. You can see the camera's actually on the right, kind of shooting from 5 feet upwards, and there's that black matter box in the background that measures the ambient temperature to get that proper temperature for the eye. The temperature's accurate within 0.3 degrees, and you can move 30 people per minute through this corridor at an average walking pace. They do not have to stop and look at it. So this is something we installed. It's been very accurate for us, and we've been very pleased with the results. We already had Rapiscan X-ray machines in our building. Working with the NBA, how do we further reduce touch points with patrons that are coming into the building? We had Rapiscan X-ray at our 24-hour entrance of the building and the employee entrance, not at the public entrances of the building. We still did manual searches of what bags were allowed to come in, were searched manually. The league came out with a policy in order to reduce touch points. It was, and by nature, a security upgrade. Going forward, there are no bags allowed in our building, with the exception of medical bags and child care bags. What that did necessitate, though, was to have public-facing X-ray machines to account for those one-off bags that were coming in, because we don't want to manually have to search them. So we got rid of the manual search of bags. We used to allow a certain size, and it's a 12 by 14 by 6, I think it was, that used to be allowed in, no backpacks. Now we're not even allow that. We'll allow a small woman's clutch or a small clutch, and other than that, nothing in the building. So we had to go out and purchase additional X-ray technology, made a spend on that. But also the important thing here was it was something we could use in the future. It wasn't just limited because of COVID. It's something we'll be able to incorporate into our security program going forward. Not advancing my screen here. Okay, next one was the Clear Health Pass. So the league is actually, the NBA league has actually a partnership with Clear. We do, as you heard me say before, we do test our employees coming in if you're working in certain zones. Right now, because we didn't have this health pass in place, we're using a spreadsheet, and the HR is having to manually input who's tested, who hasn't, and looking at a piece of paper when the person comes in to make sure they're on the list. That does become rather cumbersome. Clear has a technology that interfaces with the lab, BLR or BRL, When the results come in, it's sent to the Clear app. The employee just has to show the app that they're clear to come into the building. It takes a lot of the a huge amount of administrative burden off of the company, and that is just being brought up to speed now. We have not taken this on yet, though we're working on a partnership on this right now with Armored Things, the crowd intelligence software. The name's a little bit of a misnomer for me. Armored Things tells me that we're talking about ballistics and armored vehicles and such. It is actually analyzing crowd logistics or crowd management, crowd intelligence. They seem to have cracked the code on the holy grail of how many people are in a physical space, getting that count accurately. It's a combination. They utilize your existing video cameras, and because we have access cameras, they're getting more than the feed they need to be able to do that, in conjunction with Wi-Fi and wireless signals. So the algorithm analyzes that data and then is able to very accurately estimate or count who's in a given area. And they can do it by floor in your building, by room in your building, on my entertainment plaza outside. This has COVID implications, so we can show the health department that we're keeping our densities down and that we have certain 6-foot spacing throughout our building. It can alert us if we're getting overpopulated in an area and we need to spread people out again. Getting past COVID, crowd counting for me is huge, especially outside. Hey, did I have 5,000 people? Did I have 12,000 people? That's really important on our security deployments, our police personnel, and those kinds of things. So we're excited about the possibility of bringing this online. And then last one but not least, this is kind of a hot topic in the world right now. Traditional magnetometers are great. You get about 350 to 400 people per hour, through a magnetometer. Evolv Express it's still a magnetometer, also with Z-Wave technology, magnetic or microwave technology. They are able to pass over 2,000 people per hour through one of these units, times 2, because it's 2-sided. So if I can flow several thousand people an hour through this, and they don't have to divest their equipment, there's no more tables and searches going on, this could possibly be a game changer. So the league is evaluating this right now on behalf of the teams for the NBA, and this is a big one. So another technology that's looking to be leveraged here. I think a lot of us will see this over the next 2 to 3 years. Tips and tricks. Just a couple lessons learned here. Barriers are important. Dennis Williams is our VP of operations and now the general manager of the building. He saw early on that we're going to need a lot of plexiglass. He went out to every store in the area and ordered hundreds and hundreds of panels of plexiglass, which he's probably the reason we can account for the fact you can't get your hands on plexiglass right now. So he knew that was coming. It was going to be important. So we built barriers. This was our X-ray machine at our main mag checkpoint at the 24-hour entrance. Our in-house shop built that barrier to keep our people that are screening safe. Not a high-dollar item, especially because we kept it in-house, but a very important one for us. So barriers where you're going to have closer contact than usual have been important for us. Spending a significant amount of money on signage. I can't overemphasize this. I think our initial budget was 100, and we probably spent over 150,000 on just educating people, masks, zones, those things. That's been a huge one for us. And then low tech's okay. So this is one. The question came up. Well, how do you pass when you're putting the plastic bowls to divest and push things through a magnetometer or an X-ray machine, and having to clean that every time? It's not efficient. It's not safe. And our staff came up with, well, hell, we've got leaving the building and we've got about 80,000 of these French fry containers. Can we just use these? And those cost 1.4 cents each. So it's a very reasonable way to have a vessel that's a one-time use. It's thrown away and recycled and goes right next door to our recycling facility. And that's been a low tech. So my point here, maybe we don't have to get caught up in the high tech stuff all the time. Sometimes thinking low tech is the way to go. So that was a fun win for us. And that's some of it. We're talking technology. That's the low end technology that we've been able to get into here. So I think I flew through an awful lot there. I'm trying to be mindful of time and make sure everybody else is able to speak as well. So thanks for having me. And I think that's the end of my time. Any questions?
I think we jumped one slide too far there, but yes, we wanted to stop for a minute and ask questions. Had a couple questions, and I know I'm trying to be mindful of time as well. So again, reminder to everyone, please pose your questions using the Q&A function. There's a question on the right-hand side in a menu if you're on a laptop, and at the bottom of your smart device. But first question we had, Adam, was you talked about these various technologies, and certainly you gave some examples of what you were using at your venue. But what advice would you give to anyone who's questioning technologies, trying to get information, and not only trying to find the best technology, but more appropriately, the best technology for their venue and their situation?
Sure. My first question is always, what other sports venue are you deployed in? Is a very important first question. And it's shocking how many people go, none. They want to be the first one because they want you. It's important to get that NFL, NBA, NHL name on their client list. So that's a very important first question. And the second thing is get your hands on the device itself before you ever buy it. Take it apart, look at it, bounce it off the floor, whatever's appropriate. Understanding durability, does it work? Get a trial run done, proof of concept, make sure it works. And then I think this industry is very good at this. Call your business partners, call your other teams. We're competitors on the field, but this industry is very good about sharing information and what works for each other. So those are some things that I really rely on to make sure we're getting the right technology.
All right, thank you so much. And one more question before we move over to Troy. And again, please feel free to pose those questions. We'll make sure we get to them. If not during the presentation, after the fact. So this one came over, shameless hello to James. I see this question's from you. Great to see you on here. But the question is, in terms of preventing bottlenecks on ingress and egress, where are you in terms of crowd flow post-pandemic?
Probably not fair for me to ask. I'm gonna guess Troy might be able to ask this one better. I'm only allowed 250 people total in my building, and that includes players, support staff, and everybody else. So my egress is about 27 seconds right now.
Okay.
So and zero bottlenecks on the way in. So not quite there yet. It's hopefully not to put Troy on the spot, but he might be better since I think he's actually had fans in the building.
Yeah, that's
absolutely.
So what?
Go ahead. I'm sorry.
Oh, I was just gonna say, if you want to cover it now, or do you want to go through your piece and we'll hit it after the fact?
You know what? I might cover it in my piece. So if I don't, then just ask me that question at the end.
Okay, that sounds great. So we'll hand it over to you, Troy.
All right, great. Thank you, Adam. Appreciate it. Thanks, Daniel. Good afternoon, everyone. I'm just going to kind of walk through, how we did things here. Kind of a lot of the things Adam said, you're going to hear again. So when this all broke down in March, we were all like, all right, first and foremost, we got to make sure everyone's healthy. We all got sent home. I believe it was a Thursday. We got an email, a call to get on a call with the exec committee. Got on that call and found out we were sending everyone home at 1 o'clock, and we're all going to work from home. So that adjustment of like, wow, what's going on? I knew this was bad. Now we can't even come to the office. Well, in the football world, I was like, hey, okay, I get it, but we don't start playing until August. So we were pretty confident that the baseball guys, and those of you on the phone from baseball, we thought for sure you would be the first ones that have to cross this bridge, and that we would just do what all the sports leagues do and just follow suit. So that didn't happen. And as Adam said too, as we got closer to our season and this drug on, the uncertainty just became in the stress. I mean, we all know it. We're all going through it. I think we're all COVID exhausted at some point. But to prep for a plan to get fans back safely into your building was no easy task. It took a lot of work, a lot of collaboration, a lot of stress involved, a lot of what ifs. Nobody knew. We didn't know what was going on. So I want to kind of take you through that how we ended up overcoming that, because right now we've had 7 games. We were allowed to have 6,000 fans our first 2 games, and then the governor let us have 12,000 for our last 4 games that we had. So we're capped at 12,000 plus suites. So our in-house capacity potentially is about 13,500, and we've gotten that for the last 4 or 5 of our games. So so what we did, backtrack here. So what we did is we hired a consultant, Populous. They're out of Kansas City. Really, really valuable partners to have. We collaborated with our health provider, University Hospitals, who has a huge network and a huge presence here in Cleveland. And basically what we did is the NFL, and I heard Adam say this too, the leagues, and at least on the NFL side, did an amazing job of guiding us through what our protocols were going to be. So one thing the NFL did, I thought was really smart, is they have a stadium operations committee and a stadium security committee that's a liaison between the leagues and the other stadiums, and they got our input. So we kind of worked through this as a team between the NFL and the operators, and then the medical folks really drove it. So one thing I want to be clear on is that this was not the leagues. The leagues don't have the power to host fans. It all comes down to the local government first, and that's what we found. When we went petition the state that we wanted to have fans and present our plan, they sent us right to the locals and said, you got to get local approval first. So we had to do this shortened presentation that I'm going to show you today for the locals, and then we had to do it again for the state. And like what Adam said, I think what we found out is our plans were so solid that the state and the locals started adapting some of our requirements and applying them to other businesses when they came to want to reopen. So it was a complete collaboration between Populous, university hospitals, the NFL, and state and local health providers that got us through. We keyed on 7 key principles when we went through our plan. We learned early on a call with the NFL Players Association that the only enemy, and it stuck with me, of this disease is space. So it's all about physical separation. So as soon as we knew we were gonna have to live with the 6-foot social or physical distancing, it was kind of easy to figure out how many fans we could have, because you look at your seating bowl, we hold 68,000, seats are 19 to 22 inches apart, you need at least 4 seats, you're selling every 5th seat. Now, we also can strategically sell them in pods, but basically that's how we came up with this plan. So we based it on 20%, which for us was right around 16,000. And that's the plan we went to the state with. So the principles that we really pitched and focused on were face coverings, no brainer, CDC guidance, also NFL guidelines. Health screening, we are required to do a health screening questionnaire to anyone that comes through the back of the house. Now, the NFL and the NFL Players Association handles all the players. So when I'm referring to that, I'm referring to every other support group, broadcast, media, ushers, security, ticket takers, all your back of the house staff. We're required to take their temperature, and we have protocols in place if they fail that temperature check. We have a health screening questionnaire that we have to also ask everyone that comes in. So that's one area. Adam hit on this too, and it's a no-brainer. Cleaning, disinfecting. I mean, the calls we got, right after this hit, how everyone's going to come in and spray our whole stadium down and save everyone from COVID. It was, in the beginning, you're like, yeah, that sounds great. And then when you had to go through it all, it did become exhausting. And you got all these people coming at you at one time, and we weren't even sure what we were up against yet. So to Adam's advice, yeah, take your time, vet through all those, talk to your industry partners and network with folks who have been through it. They're your greatest resource, because there's a lot of things out there that you have to whittle through. And one thing we all have to keep in mind is revenue is way down. So whether you're doing a game with 250 people and we're doing it for 12,000 when we normally have 68,000, a lot of lost revenue to make up. So you have to be really strategic on what technology and what processes you put in place. Health protocols, I will give the NFL credit. They're very strict on back of the house and making sure that our event staff follow the same rules. We had to have the same signage. We had to have robust training with the back of the house staff as well. It wasn't just all about players and fans. They really kind of took anyone that walked into our stadium, any human being, and applied those protocols to. And then signage, education, and communication, yeah, huge. We started out the same thing. We thought we were going to get by with about $100,000 worth of signage, and we found out very quickly that it's at least twice that, 2.5 times, I think, by the time we got through. Same thing on the plexiglass. We had a plexiglass every player area, and I got some slides that I'll show you and some suite areas. But between signage, education, public education, training of the event staff, and communicating was another guiding principle. Then the last one was accountability. The NFL is really good at that on a normal year, making sure we're following all of the stadium security best practices. Well, the same thing when they put out their stadium preparedness guidelines. We had compliance audit checks, and we had, there was no shortage of manuals and protocols that we had to follow. But looking back, it was all worth it, and it all paid dividends in the end. So, and then being flexible and just being able to adjust on the fly to things that you learn, because we didn't know what we were up against. Trying to advance the slide there, Daniel. Went too far. All right, so we did the same thing as Adam alluded to, but this is more on a fan basis. So what we did was, and the question was, how did you maintain your 6-foot social distancing? We knew line management was going to be a challenge. luckily, through CDC guidance, there's this thing called transitional interaction, which as long as both parties are wearing face coverings, you're allowed to cross each other momentarily. So we knew when we had fans sitting in the seats, if one got up while the other one's going down, we didn't have to do anything special. We didn't have to have an up aisle or down aisle. So we knew the first point of line management was going to be at our gates and our security searches. And I will just say that all of these protocols, the real challenge was that these were in addition to all of our other NFL best practices and security protocols that we have to follow. Those didn't go away. We still had the threats of the vehicles. We still had the domestic violence. We still had the active shooter threat that we still had to work through. All of these protocols were layered on top of it. So it was really something else to kind of get to this point. But the first thing we knew we had to do is we had to separate our crowds. So we ended up creating zones, and we did it through our sponsorship gates, our sponsored gates, because that's where our fans are used to going. And we just split up our stadium into quadrants, and we force you to stay in your quadrant by level. So normally, if you look at the sheet there on the red area is the University Hospitals area, there's normally 2,600 fans that are in that quad. Under the new 20% rule, there was a total of 5,200 spread out over 6 levels. So really, to answer your question about the spacing, we have so much square footage. We haven't seen any real issues with fans crowding up. And the other thing I can speak to is we sold our seats in pods. So it was really hard for the staff to say every single person has to stay 6 feet away. It's your pod that you sold your tickets with. You could get on the elevator together. You could stand together in line at a concession stand. So it was just things we had to learn and work through. But separation was a key. And that's one key element that really the health department liked, because under this scenario, if we did have a confirmed case here, we can go back to their seating area, feel pretty confident that they were only on that level and that zone. So we're not sitting here having to worry about 12,000 or 13,000 people that were here. It's just the capacity of that quad. I only pushed it once that time. All right. Okay. So just kind of put a perspective in what we were up against. It's going to advance, I think, is that normally how our stadium is set up, we're positioned on the lake. We have no parking behind the stadium. We have about 1,200 spaces. That's all internal. So all of our fan parking is between a half a mile and a mile away from the stadium. There's 44,000 surface parking spaces in the city of Cleveland. So 95% of our fans walk. And under normal conditions, when we have full house, the University Hospitals gate will ingress 24,000 people through that gate alone. Over at the Meyer gate is our highest gate is 28,000 fans. So immediately, yeah, we're not going to have as many people here, but we know our fans' habits. They're still going to crush those gates. So how do we combat that? Combat it through messaging, through technology. We reprogrammed all the Ticketmaster scanners, so you couldn't get in. If you were seated in the Cree zone and you tried to get in the University Hospitals gate, it would deny you and you get forced to go to your gate. And if you look down the spreadsheet on the right, just kind of bears that out, how we were really able to focus on separating our fans. So we almost all 4 of our main gates hit that 20 to 24% on ingress. So it worked really, really super well, which was obviously a selling point with the health department and keeping folks away from one another. I'm not sure, Daniel, why that takes so long to advance. There we go. Oh, they went too far. So some of the strategies we deployed to keep folks away. The picture on the left is our seating capacity. The NFL did do one thing that I thought I spun, twisted me around a little bit. They required us to take every seat we're not using out of service. So if we have a capacity of 16,000 and we have 68,000 seats, that's 52,000 seats we had to take out of service. It was no easy task, and we looked at several different technologies. Believe it or not, we looked at removing the seats. No way, couldn't do it, took too long. Where are we going to store them? Then we looked at taking the seat bottoms off. It doesn't work, can't store them. How will we ever get them back on the right seat? So the most reasonable and cheapest alternative was we used tie wraps, and I'll get into the challenge of that when I get to the technology piece. But so we had to literally tie strap 52,000 seats in order to host fans. So what we also did is we applied a sticker if you look on the left, to the seats that were sold. So if you're the usher working that section at the top, we have a real problem with fans removing those tie straps or breaking those tie straps and sitting where they don't belong. We now know that if you don't have a sticker on your seat, we know that you did that, and then we can take the appropriate action. The picture on the right is plexiglass. We had a plexiglass between every single one of our suites. We had to take some of our suite capacity down from 15 to 16 to 10. So we're to ensure that social distancing. They did have to wear their face coverings. But yeah, plexiglass in between every player locker room, every back of the house area, every concession stand has plexiglass. It was about a $225,000 spend just for plexiglass alone, and probably another 50 to 60 for installation. So zone integrity, this is how we set up our concourse. We did everything color coded. So we had bike rack covers made, and we put bike rack across all the concourses. And if you were in the CRE zone and you had a ticket for the CRE zone, you couldn't pass over into the 5th, 3rd bank zone. And that's how we managed you once you got in. And it worked really, really well, especially once, the first two games, we didn't restrict the scanners. We just kind of let crowd flow the way we depended on our advertising, our communication, and the text messages and the app to get us through, and it didn't work. Fans did their old habits. They all hit those 2 main gates. So we had to make a quick adjustment, and that was one of the 7 guiding principles I talked about, is just being flexible and making adjustments. Once we put the scanner restriction on, then all this became much easier, and there was very little back and forth. Now you'll notice those are staffed and removable, so if we do have to do emergency evacuation, fire marshal was fine. Because of those 2 elements. So. All right, so just kind of tie in the technology piece. So we here, and Adam and James and us, we were talking about it earlier, we got pitched a lot of technology, but in our world, in Cleveland specifically, we look at it, we do 10 football games a year and 2 or 3 major concerts. So we're not an arena, we're not doing 300 events a year. We had to really kind of sort through all the technology pieces that we got pitched, and we ended up of just relying on existing technology. And the number one thing that we used that we really upped the game on is our CCTV monitoring system. We too are an all access solution, but it became even more valuable than it is on game day. So mask compliance. NFL has a directive. They want our command center actively looking through the crowd on cameras and then enforcing the mask compliance. Seat integrity, same thing. We have to make sure that no one's removing those seat straps because they did it. We found out last game they're also removing the stickers. So again, we're gonna have to make an adjustment for our next game and reset everything. The zone integrity, we have the command center. This is a pre-COVID. It's about a third of that now because we had to spread that out. We also took this and went virtual. So we had a fan text area that we created upstairs that was away from the command center. And then we had police and medical in a separate area. So we really had 3 different command centers, and we connected them through Teams. And we found out it worked really exceptionally well. We didn't really lose a beat. So seat integrity, zone integrity. We use the camera system when we get a text message. First thing we do is put the camera up. We have undercover guys respond sometimes. So we want to make sure that if a fan, we'll communicate back to the fan that we're taking a look at it. We want to make sure our guys are there. Something were to happen, we want to be able to have backup ready. So we use that a lot for fan text message. Staffing levels, and you saw the pictures of our zones inside to make sure that staffing, it's more quality assurance is probably more appropriate. But we make sure that the staff is staffing those escalators from a safety standpoint, that they're at the cutoffs on the concourses, and that we can make adjustments if they're not there. And then again, we use it for line management. We make sure that, if we're having issues at concession stands, and one challenge we did find, which won't surprise anyone, was our bars. Most of the food lines were great, and everyone followed our stickers on the floor, and everyone stood 6 feet away, but not at the bars. The bars, they were like it wasn't even COVID, and they were all crushed in there. So we would monitor that on the camera system, and then deploy appropriate personnel to combat that. Live incident monitoring, we all do that. It's very, very valuable. We put this system in 3 years ago. Before that, we had 28 analog cameras and really didn't have this asset at our disposal. We're still learning ways to use this and the value out of the system. And then the big piece is incident investigation. It's really invaluable when we get the hate mail the next day to ownership, how they were mistreated or they were thrown out and they weren't doing anything. And, we had a lot of that, and it was all related to, we did a lot of ejections for mask compliance. I mean, the old world we lived in was all alcohol management. Interesting enough, until our last game, which was a Monday Night Football game, all of our fan incidents were all seat integrity and mask compliance. 12,000 people here. I think there's a reason for it. I mean, we kept our security staffing at 100%, our police staffing at 100%. I think we had them outnumbered. So normally where fans would kind of hide in a crowd and misbehave, now they're sitting in pods, and now they see the security is so visible. So I really do think it had a huge impact on fan behavior. It didn't have much of an impact on mask compliance. There's a third, if you read the data, a third of folks don't believe in this. They don't want to do it. It's tough. We're battling them constantly. So interesting enough, that Monday Night Football game, it flipped, and we had more alcohol-related issues than we did COVID issues. So anyway, with that, I think that's about all that I have, and happy to take any questions if there are any.
We did have some. I know for the sake of time, I'm probably going to hold the questions until we wrap up. So we're getting a little bit low. We're not going to forget about you. We'll make sure we get to your questions. I see a few in there. So with that said, again, for us, we are mindful of some of you will need to drop at the top of the hour. We're going to get through the content, but we're going to hang out and answer questions and make sure we get the answers you're looking for and have the discussions you'd like to see on the back end. But again, we'll try to get through the content by the top of the hour. Keep in mind that the slides as well as the presentation, we are going to pull those down and make them available on the website. We'll push it out to you via email and certainly social media after the fact as well. So this will be a resource even after we wrap up here. With that said, I'm going to go ahead and hand it over to James.
Thank you. I appreciate you having us today. And it's always great to be able to share experiences. And it's interesting that even though I'm in the hospitality industry now, that we're still dealing with populations that are not normally used to our buildings or visiting our buildings for the first time, unlike office buildings or colleges or campuses and things of that nature. So it adds an interesting mix, especially after COVID, and you're trying to convince people to come back to your properties or come back and be a guest. So we've had some challenges. So we'll go ahead and get into it. One of the unique situations, a lot of similarities with the other presentations, but what was unique with us is we're a global company. And our global incident crisis team started in beginning to mid-December dealing with this in China. We have thousands of properties in Asia Pacific. And so we were dealing with this early on, which gave us a little bit of a head start as it started to become more and more of a concern in the United States. Again, if you're talking about, and when you look at that initial number on there of 6,100 properties, those are just the managed properties. We're not talking about the franchise properties, which had a component too. So, between our intelligence team that was tracking a lot of the information globally and feeding it back to the incident crisis team, we also have a business continuity team that helped us really shape how early on they were learning, but we took those lessons learned in Asia Pacific and in Italy and Europe before it really became an issue in the United States. So we can kind of address some of the concerns we had and had to deal with here in the United States. So let me see. Okay, slide worked. All right. So, once we activated our global crisis team, which probably the first time we always have had to activate area crisis teams in different parts of the world, but we've never had to activate the actual global crisis team until this incident. So it was a first for us. And one of the biggest ways we were able to be successful in this, dealing with those 6,100 managed properties, but also the tens of thousands of franchise properties, was our Hilton Alert system. It's actually piggybacked all. It's a technology. It's called AlertSense. It's kind of a mass notification system, but it's really designed not for guests or attendees, but our properties. So we can push out checklists, we can push out reminders, we can push out alerts. But it really became useful when it came to tracking contact tracing. So that's what we utilize to allow franchise and managed properties to notify when they had a positive guest case or a positive employee case, because then that immediately alerted not just me in charge of my region, but it also alerted our media, our legal teams, our HR teams. So that information got to everybody at once. So that was probably one of the biggest pieces of technology that helped us and made us successful. So like I said earlier, once we started dealing with it, we already had a pandemic guidelines, our viral outbreak controls, but then we created a new respiratory viral infection guidelines. And you'll hear me reference a lot guidelines, because one of the challenges that we faced is, again, global. You're dealing with different regulatory programs by state, by city, by country. So we really had to make a lot of our things guidelines, and you know, properties would reach out to us, and we had to almost like a lawyer and give them advice. Here's the guidelines. Here's what our Hilton policy says. But you know, we also had to understand that they may have different regulatory requirements that they needed to meet as well. So we referenced, we got a lot of the guidelines in place. We used, we started developing different operating during pandemic controls, because you know, you go to a hotel, you stay at a Focus service, you got a Hampton Inn, it's self-service your breakfast. Well, those self-service buffets and all that had to go away. We couldn't have people grabbing the spoon and another person grabbing the spoon. We had to switch to more grab and go situations. So we really had to think about how we operated as a hotel altogether. And honestly, I think some of the things may be here to stay. Same thing with the distancing, how you distance in an elevator. If it's your whole family, you can get an elevator together. But if it's a small elevator, it may be one at a time. And, you know, just the things like elevator etiquette, it all really became a challenge for us as we started to go through this. So basically, we got together, we sat down, and we worked with, we wanted to collaborate, not only with our properties, because one thing we didn't want to do is we didn't want to be the global headquarters that just told properties what to do. So we had a project Phoenix group that was made up of property level leaders and corporate level leaders, so we could collaborate and make decisions that made sense. Because I've worked at a property, but it's been a long time. So we really needed that input from the property level to see if this stuff would work. But we also wanted to make sure we were doing things, you know, this is all new to us and how we're going to now clean. So we developed that relationship with the Mayo Clinic, partners like Lysol, just to make sure that we hit the touch points and we cleaned to a level that was acceptable to ensure, you know, confidence back into our base to come stay at our hotels. So one of the things in Clean Stay that I've actually stayed at a hotel since this is not only using technology and the digital key and trying to get people more and more used to being able to check in remotely, bypass the front desk, go to the room, check in with your phone, never have to touch a plastic key, never have to talk to a guest, or excuse me, a representative at the front desk. But the seal was very interesting. You know, so the last person in the room is the manager, inspects the room, they hit the 10 touch points, the remote control, the light switch, the things that we identified with the Mayo Clinic that was big transfer points. Once we clean those, that person last in the room puts that seal on the door. So when you check in, you're breaking the seal to go in that room. Again, a way to ensure confidence into our base to get people to feel comfortable staying in a hotel again. Talked a lot about this already. I want to spend a little bit of time on talking about technology, but here's a lot of the things that were included in our clean stay, the touch points I mentioned, from the remote control light switches, doorknobs, heating controls, increased frequency of public space, making sure we're using proper viral cleaning when we clean, reducing paper amenities, and really educating our staff. We actually had to shut down a lot of hotels. In my region alone, 50% of my hotels had to shut down or suspend. I still have a lot of our big boxes that really depend on large group business that are currently, like the New York Midtown Hilton, the Palmer House, the Chicago Hilton. Those big hotels are still suspended. They still do not have guests in them. So we're still dealing with the challenge. We're still trying to make sure that we can get people confident to go ahead and start traveling again, and hopefully again dealing with different regulatory bodies, making sure that we can have group business again. But talking about the technology, one of the challenges, I love the buyer beware, because same thing from us, not only from security but from cleaning technologies. And when you get these technologies, especially if it's a cleaning technology like a mister, the mister may be great and they sell it, but then they recommend you use this chemical. You need to look at that chemical, because that chemical, when you apply it in a mister form, requires a whole different level of PPE and could be downright deadly when put in a mister form. So we had vendors that were providing us information on a product, but when you looked at the recommendation and you go to Ecolab and ask them about their chemical, they said, no, don't put it in a mister. So you got to make sure that it's not only the technology they're selling you, but in the application of what they wanted to use. We had one company wanted to sell us a UV light. You put it in their room and turn it on, and it's going to like bake the room with the UV light. Well, we read the instructions, and the instructions said no person can be exposed to it for more than 5 minutes. Well, if you don't read the fine print, sure enough, someone's going to go in there and say, I want to watch how this thing works, and they're going to sit in there for 10 minutes. So you really buyer beware, definitely. But it was also a global issue, because you have those U.S. companies that for most purposes are going to probably do the right thing. We had companies in Egypt and the Middle East that wanted to sell things that look like metal detectors that literally sprayed your guests with a chemical as they walked into the building. And we had properties, franchise properties, Hiltons, that wanted to use this, and we had to tap the brakes and make some brand standards, because that's the way we can control our franchises, to make sure that they didn't do something that would hurt our brand by having people walk through car washes as they go into a hotel. So we really had a lot of challenges with the global piece. I will say that, communication, the tools that we had to communicate, we've all been using them, really, helped us controlling the policies. But again, the challenge, the same challenges the stadiums have had, we have as well, but a little bit more unique. When I worked in sports and entertainment, I remember I was allowed to be a little bit more less friendly in the security role. But hospitality is hospitality. You're coming to us, and we want you to feel warm and comfortable. But now we're telling you, because we made it a brand standard, you have to wear a mask. And again, it might not be an issue in New York, but it's an issue in Florida. And so, trying to balance that, hey, welcome to the Hilton. We're glad that you're a Hilton Honors member. We love, what can we do for you? By the way, put your mask on. Becomes a challenge, and it becomes a teaching moment for a lot of employees, and it comes down to consistency, because you get employees that start to slip on that consistency, and then the problem starts to snowball. So you just got to kill them with kindness is the way we've been trying to deal with it. But compliance has been a challenge on the employee side as well. You're talking about temperature screening in certain areas. Some technologies out there that we've been trying to be sold on is they can walk through. If it's elevated temperature, it'll email your HR. It's like, okay, well, if they come in on the third shift and it emails my HR and they're not in yet, that person with the elevated temperature has been in for 4 hours before HR shows up. Well, we can send it to these other people. Okay, what if the employee knows they're sick, needs the money, doesn't want to come, go home, so they bypass the machine at the employee entrance? Who's there to watch that? So with a lot of the technologies, I will just stress, whatever technology is out there, there needs to be a protocol and procedure along with it. If you get someone that's hit on one, we had a lot of resorts, some of our resorts in Vegas wanted to go to thermal cameras throughout the casino and get hits. And I'm like, okay, well, when you get the hit, what are you going to do? Well, we got the hit. Okay, who's responding? Are you doing a secondary temperature screening on the spot? So with technology comes procedure. Technology doesn't solve all your problems. You've got to have an answer to address those procedures and those steps that are going to be taken next when that piece of technology alerts on something. So I want to leave some times for questions, but I will just say that communication and the alert sense tool, coupled with our emergency procedures platform Fusion, allowed us to track everything from what property was suspended, how many cases we had, how many positive cases. Those two systems were probably key for us, and then just being able to manage the constant, ever-changing regulatory landscape from a U.S. as well as a global standpoint, and making sure that we're staying in the lanes. That's all I have.
All right, thank you. And Ryan, while you're taking control of the slides, what we're going to do now is we're going to roll into Ryan. Last but certainly not least, we've covered a lot of ground here. We talked about a variety of technologies. We talked about things that you currently have, things that you might be looking for. And in this case, Ryan is come to us to talk a little bit about how we can apply surveillance to solving some of these problems. And most of our venues already have camera systems in place. So what's currently there, and then how can you leverage it for your operations, and certainly the new policies you're seeing. And as a reminder, we are going to make these available. I know we're getting toward the top of the hour, and some of you may have to leave us, but we are going to make this available on our website. We'll make sure we push it out to you via email, social media. So it'll be here as a continuous resource along with the slides. And we're going to hang out and make sure we answer your questions. So if you can stay with us, that's great. If you can't, we completely understand. And we thank you for participating to this point. And again, I wish you guys the happiest of holidays. So with that said, Ryan, I'm going to go ahead and hand it over to you.
Okay, thank you, Daniel. I'm going to kind of cut this down because I know we're a few months behind here. But really, we know video being used for general surveillance has been around since the late 1940s in the United States. Really took off in the 1960s, but today's video systems are very different than that. They probably bear more to what we're used to, computers. We have a lot more compute power for doing things like using analytics, for analyzing scenes, and for going back and looking at video and even exporting that video as well. In stadiums, what I've seen out there is the ability to actually use cameras to zoom in on crowds. If there's an incident, you can actually see live in real time people scuffling, all the things that two of these gentlemen get to deal with. And I'm sure in hotels you might have some scuffles as well, but it just brings a new level of situational awareness to what's going on. And of course, what's really important is beyond that, that video can be used to optimize operations, to look at processes that are happening and optimize those so they're more efficient, do things like queue lines better. If there's large buildups of lines, maybe bring more personnel in, or maybe make announcements to have people move to other places where they can buy food within the stadium. So there's all kinds of different uses video can be used for in addition to just surveillance itself. And of course, part of that really comes down to making the video smarter, having that ability to use analytics. And analytics, I think may have gotten a bad rap probably at least 10 years ago when things were just overpromised. There are limitations to analytics. There are limitations to what you can do, but properly applied, the idea behind analytics is to make information that you're gaining from a system more actionable, to reduce the huge amount of data that you're collecting on a system through video and make it something that can be easily processed, easily understood, and acted upon when you need to. And there's a whole variety of analytics out there, everything from line queuing to things like loitering, the license plate recognition that can be added into these systems very easily in most cases. It can be added just directly into the camera itself, much in the same way you upload an application to your smartphone today. So that's just one way that efficiencies can be gained, and those analytics are getting better. We'll hear, if you're part of this industry, you'll hear a lot about AI being introduced into this to make the analytics smarter, being able to train it for certain scenes. Of course, that's out there. Using AI, of course, is no guarantee that it's going to be better than an analytic that's out there today if it's not properly trained, but it does open the door to new possibilities as we move forward. And of course, there are also other technologies that are out there, such as radar, such as using audio, which can be paired with analytics. Radar is great for seeing people coming up to the perimeter of building. It's also great for looking at fields, especially when no one's supposed to be out there, for seeing that someone is out there and they should not be. So it's another technology, just really complements video systems. And of course, audio can be used with analytics to do things like crowd aggravation detection, glass breaking, even gunshot detection, just really adding to the amount of sensors you have out in the field to really process data, to see what's going on and increase that overall awareness. And of course, as we look at all of this as well, we have to keep in mind cybersecurity. I think it'll come as no shock to anyone that cybersecurity is one of those things that makes news headlines very often. Since these systems today are IT systems, use reputable manufacturers, ones that have good reputations for keeping their products secure, and deploy these systems in secure ways. I see a lot of that being done and done much better than was being done just a few years ago. I think it's mainly because awareness has gone up quite a bit. And I think that gives us the ability to do a lot more with these systems. And since they're already out there, adding on these new technologies to existing systems is a very easy thing to do. And that just really increases the value of them overall. And so with that, I'll just kind of bring it back for any questions, and we'll go from there.
All right. Well, at this point, we ask a couple questions. So again, if you haven't asked a question, you got something on your mind, or you'd like to hear something from one of the panelists here, please go ahead and post your question. I've got a few questions here I'm going to ask. And as we go through that, again, if you have anything, please post it, and we'll have fun with it. So the first question I had, going back to one I ignored earlier, not intentionally, we were just trying to keep time, but we were talking about, you'd mentioned surveys, Troy, when you were going over some of the things. You were talking about back of house surveys, but the surveys you're doing, the COVID surveys they're going out, what does that look like for you? Is it strictly back of house? Or are you also using that with fan bases? And I said Troy because it was brought up during your discussion, but certainly any insights are more than welcome.
Yeah, you're talking about the health questionnaire. So yeah, I mean, there's a lot of apps out there, but it was tricky because there was this big discussion about, okay, is it a health record or is it not a health record? What if it's on an app and someone can't get a connection? So what happens if they accidentally say yes to a question they meant to say no? Holding up those lines. So we're required to do everyone that comes in back of the house. So broadcast media, all the event staff. We have a broadcast area, we have a media area entrance, and we have an employee entrance. We have to deploy staff. And what we chose to do instead of going to the technology route is we just made the A-frame sign with the 8 questions on there, and we made you step up, read the questions, answer the questions, and then go to the next step, which was a temperature check. And to James's point, just because you're doing a temperature check, well, what's the next step? What happens if you fail? So the protocols we were under was 100.4. If you were over that 100.4, we had to provide you a cool down area, which was close proximity to whatever entrance you were at. 10 minutes later, you could be retested, and if you passed, you're allowed to enter. If not, you were told to go home and contact your HR manager. So we had no issues. We had no problem. We did Monday Night Football here. We did Thursday Night Football here. We processed around 300, 400 folks through the media broadcasters, and it was flawless. So that was just, and same thing with the employee entrance. I mean, the security screening takes a bit. So our media is set up where you come in, you'll get the health questionnaire, you get the temperature screen, then you got to take your bag through the x-ray, then you have to put your person through the magnetometer, then you got your credentials scanned, and you get in the building. So all those steps took a little time anyway. So the health questionnaire was an easy thing to administer. And we had no record of it. We didn't want any records. You know, even if we denied you, we didn't even want that. We left that on you. We just weren't going to let you in.
Great. Anything to add for the other panelists?
Almost verbatim the same thing. We went to a whip sign that answered these questions rather than given a piece of paper to sign. You didn't want the records. The requirements for HIPAA had been waived with regards to COVID crisis, but we just didn't want to touch it either. So we did the same sign. We were using for our day-to-day operations a Protect Well app. The employee every day signs on, answers a question, hits enter, and then they present that screen on the way in. So if they're a regular employee, they present the app screen. If they're a visitor or a contractor coming into the building, they answer the health questions and then move through the process.
Okay, fantastic. All right, so just a couple more I'm going to throw out there. One of the things everyone mentioned, either guests or spectators, and obviously when you have these people coming in, they can either be a big part of the solution or in some cases a big part of the problem and make it a little more challenging. So with that said, what are some of the tips and tricks in communicating with spectators or guests leading up to their stay or their participation at your venues? So what have you found to be effective in just trying to communicate and trying to prepare them for what's to come?
I'll go and tackle it. Yeah, I'll tackle it first because we had fans. So first, the NFL did a Know Before You Go website. Everyone wanted to watch football. Everybody wants to come back and participate. They know there's nothing about 2020 that's normal. So anyone that came here with an expectation that it was going to be business as usual, no one felt that way. So we obviously have communication with all of our season ticket holders, and the way we ended up not having any seats on sale to the general public because our season ticket holder base is so large. So we had to divide up our season ticket holder base and offer them 2 or 3 games each. So we know who they were. So we communicated with them through email. We had our season ticket, each season ticket holder has a member of our front office assigned to them. There was phone calls made. We have it on our app. We have it on our website, and signage everywhere. So it was no surprise of what the expectation was when they got here. It was the mix of people disagreeing with the policy, even though they knew they had to wear their mask when they got here. They didn't want to comply because they didn't believe in it for whatever reason. And then you have the alcohol issue as well. And that one thing that was interesting about the mask compliance, in the first couple of games, we struggled with it. It was hot. Nobody really wanted to wear it. When fans would cheer, they would pull their mask down to scream and yell, which is what you don't want in the COVID world. So that was a battle. And then, but what we noticed as we got closer, it got colder, the face coverings weren't much of an issue until this last game when it kind of flipped the switch a little and alcohol went back up to the forefront. But it's about communication. It's over communication, really. And our stadium is ridiculously signed. We did that on purpose because we didn't want anyone to question what they can and can't do when they got here. But it's just like anything else. There's a certain fraction. You have your rules followers and you have the people that don't want to follow the rules. And that's where we're left with the fan conduct issues that we have.
Absolutely. Anything to add from your end, Adam?
Well, we haven't had the fans yet, we're prepared for it. Same thing. The season ticket holders, we're very fortunate to have a strong season ticket holder base. So Jamie Morningstar is our VP of ticket sales. She's had the unenviable task of dividing it up. I think every season ticket holder gets 25% of the games available. And then that's being modified throughout the season as we are waiting to know if we ever actually get fans in the building or not. I'm not hopeful at this point, but we'll see what happens. But we rely heavily on ticketing we interact with them to, hey, here's our messaging, and rely on them through emails with their ticket holders to get that information out, what the process is. And then there's the Fiserv Forum homepage with the Know Before You Go information. So all virtually the same stuff.
Okay. And James, I mean, most of our sports venues, you have restaurants and there's a lot of things going on that you've been exposed to in your stint with the sports and entertainment industry, but also with Hilton now. So how are you communicating with guests before they come on? What have you found to be effective in again, preparing them for what to expect once they get to one of your properties?
Well, similar, we have it on all of our websites, communications on the door. And again, DC, it's an actual law. So we have the challenges of not only it being our policy, but trying to explain to a guest that's, from another state that it's not only a Hilton requirement, it's a law. But the other interesting component to that we have to deal with is, especially in DC, which is in my region, is you have protests that are going on in DC, and you have both sides. I'll just call it the mask believers and the non-mask believers, and those groups may be staying in the same hotel. And so now I'm dealing with disturbances of the put it on, you can't make me put it on in the middle of the lobby. And it's much less of us trying to, we try to enforce it, but the next thing you know, we're trying to stop a fight at the same time. So needless to say, we've had our share of challenges throughout the U.S. when it comes to trying to enforce the policies. Our most senior leadership says lead with hospitality, which sometimes is a great thing to say, but sometimes is a challenge when you're actually being spit on and trying to deal with it in the heat of the moment. So needless to say, it's a challenge, but we've been doing the best we can with it.
Absolutely. And we've seen shifts in policy that's had backlash in the past. This one's a little unique and obviously up the scale a bit in relation to that. I mean, we've seen the no bag policy changes and the reaction there. This is that plus some for sure. So which brings us to our last question. And Ryan, this one, I'll start with you on it, but certainly input from the rest of the panel is more than welcome. We mentioned some of the analytics. I know Troy had mentioned mask policies, leveraging different technologies to tell whether someone's in a space they shouldn't be or not. And you had mentioned a couple of examples, but we're talking specifically here with some of the new policies coming down. And COVID obviously is a big part of that. Public health is a big part of that. So what are some of the analytics you see on surveillance side that they may, well, our audience may already have access to, but certainly things that we need to be familiar with that can benefit trying to implement all of these public health policies and strategies?
Yeah, certainly. With our partners, what we see is several things like occupancy and even what's called massing. Understanding how many people are in a certain area, if they're above capacity in those areas. And this can be applied to stadiums, like to actually look at sections of that stadium and get an idea of how occupied that particular area is. So a lot of analytics around that. We've seen also analytics around actually making sure somebody has a face mask on. Of course, these gentlemen have the problem of enforcing that if that face mask isn't on, but that is definitely what we're seeing more and more of in terms of analytics that have emerged from this whole COVID-19 situation, and people continue building up upon those analytics and making it easier to bring the information and making that presentable in terms of ways they can see that and utilize that in real time. I don't know what you guys are seeing out there, but that's the trends we're seeing, a whole variety of different things. Of course, like you said before, these things need to be vetted and made sure that they actually work in your environment.
Absolutely. And while I actually just had a big question, the $1 million question come in, which is, and this one I'll address I'll start with Troy on this one. It says, do you think vaccines will have an impact on your current practices? And how long do you think those practices will last? This is a conversation we actually had before we started the webinar, and you were talking about investing in technologies and those types of things. So I wanted to kind of start with you and what type of impact do you think the vaccine is going to have to what you're doing now? And I know some of that is very difficult to answer, but
yeah, it is, and we've already started kind of talking amongst our committee. The league is the fan behavior and the fan saying, I don't have to wear a mask, I've been vaccinated. I've read articles where there's this vaccination app out there, but I've also read articles where there's already some on the black market, and then there's this other document that you can get from your doctor that shows you've been vaccinated. Well, you can also reproduce those. So I don't think the league, and I'm guessing here, but I don't think we're going to change. We're already into January. Super Bowl is going to be or December. 2 more months of the season. I think we're going to hold true. So the real challenge is, yeah, I get it. That's great. You're vaccinated. That's awesome. Thank you for doing that. But you have to wear your mask when you're at the stadium. So again, it's that mindset of if fans feel they have to wear their mask or not. So it's still going to be a challenge. It's actually going to add a degree of difficulty to our masking challenge, because you're going to have folks that that's going to be their outlook, and that's what we're going to be battling.
Absolutely. And Adam, I'll shift over to you. When we're looking at investing in not just process and procedure, but also technologies for COVID purposes, I mean, what suggestion might you have? Earlier,
when investing in the technology, I think we talked about this when we were preparing for this, is hey, what can we use that we have? If we're looking to invest in something for COVID, knowing that COVID is a finite period of time, another year or so, hopefully we're out of the woods on this. Is it worth that $200,000 investment, or are those monies better used elsewhere? And how can that investment be used post-COVID? So a good example for us was expanding our X-ray program. That was done and justified and required by the league and bought into at the team level for helping with the COVID ingress once we get fans back. But those same machines are still very usable in my program, and now because of COVID, we'll have gotten to a no bag policy or relatively no bag policy, which is great. And I use those X-ray machines to help support that policy. So how do you leverage those technologies? How do they have efficacy beyond COVID? The temperature screening that we bought into, once COVID's over, do we even begin to use it again? So instead of buying, I tell you to look into a lease program. Some of these companies have lease programs on their products so for a short-term purchase, it's a little bit more expensive in the near term, but long-term, there's no commitments and you don't have a piece of technology that's outdated. So there's several technologies out there that I would tell you look strongly at the lease option.
Absolutely. Okay, and this next one I think is pretty good, and I'm going to broaden it a little bit. But COVID, the post-pandemic, what types of flexing or what types of adjustments have you seen that needed to be made to those third-party service providers you've come to rely on? What types of adjustments have you required them to make? We can start with let's say I'm assuming event services, for instance. We'll start with well, we're on Adam already. We'll start with you.
Well, it might not be a fair question for us because when we opened this building, there was a strong, very strong desire to take everything in-house. So I have an in-house security program, an in-house guest services program. We actually just took our cleaning service in-house as well. So not the fairest question. We do that because we do have control over. It's a cost savings measure. It's a lot more of a headache at the level, but if you have the capacity to do it, control your own destiny, and that's what we've done. So by having that in place, we're able to directly cut through several layers and be able to enforce our policies and procedures. What we say goes. There's no middleman. There's no anything else. So we've been very fortunate in that respect. Not really having to use outside third-party vendors for anything other than our food services product, which is Levy, and they've been very on top of it in lockstep with what we're doing and requiring. They're right there with us, if not even more restrictive.
Okay. And Troy, I know you've got a pretty large amount of people coming and going. I'm assuming you still have some third-party service providers that are involved with some of your operations.
Yeah. We're basically opposite of Adam because, again, I go back to 13 events. Is it worth doing or not? So we do use a large number of folks. So, our crowd management provider uses between 650 and 750 people per game. Do we want to take that on for 10 times? We don't. So it's interesting you say that because the biggest lesson we learned out of this, which was kind of an aha moment, which might be obvious to some of you, was we had to go to online training. So we as a stadium, we have all of our service partners, we require them to go through a First Energy Stadium training program that we drive the content. It's not job specific, it's how we want our fans treated. What are the NFL policies? What are the protocols? What are emergency evacuation procedures? All the stuff we normally do. We thought it was best to get everybody in a room, and we would do training classes of 400, and we'd have to do that 15 times. You get exhausted by the time you're doing that. So in our world, unfortunately, the turnover rate is crazy, especially this time of year. It gets colder. There's Amazon, there's UPS drivers, there's all this different seasonal work. A lot of our event staff migrates over to it. So we're forced to stop what we're doing and hold those large training classes again. We went to the online version where now we can actually measure, we can break it down into modules, and we can have questions at the end of that module that helps identify areas of deficiency. When we're doing that huge class, we're assuming everyone's paying attention. We know they're not. We also know they're not absorbing, they're only absorbing about 20% of the content. So we've really whittled down our training to just the basics, and make sure they get the basics. So that's one thing, but I will just speak to the service partners, is that it's leadership. If you have good leadership in your service partner, they become who you are, and we treat everyone as one. So we hold them accountable, we support them, we give them the resources, and anything they need, we make sure that they have. In turn, they're going to do everything that we ask them to do. And it's a good partnership. So just because when COVID came around, all those leaders became embedded into what we were doing, went out and sang the same message, and got all those different service providers all on the same page, whether you're housekeeping or a ticket taker or an event security or a crowd management person, you got the same message, consistent message, and it was on kind of all of us. It takes all of us to get through this, and that was our mentality.
Absolutely. Thank you. And before I start closing down, I just wanted to open it up for any closing remarks by the panel. Not to put you on the spot. I know I didn't ask you to prepare closing remarks. I just didn't know if you had anything else you wanted to share before we started slowing down. Keep in mind, again, if we didn't get to your question, we'll make sure that we follow up. Our panelists will all have your information. If there's anything that I can help you with, please don't hesitate to reach out. If you need additional information or you would like to connect with our panel, please reach out to me and we'll get you connected. I know as a community, we're all more than willing to share and try to help out where we can. So again, at this point, I'm going to go ahead and start slowing down. Wanted to thank you all for entrusting us with some of your time today. We greatly appreciate your support and your participation. We wish you guys all the happiest of holidays. Hopefully you have a happy and safe holidays, and you can enjoy a much needed break from the world. But we appreciate everyone participating. Thank all of our panelists and certainly Axis and Ryan for their support in putting this on. And we hope to see you all after the holidays at some of our future sessions. Thank you all so much.
Stay safe.
Thank you.